Hello and welcome to At the Table. I'm Audrey Galex. Thank you so much for being with us. And in this edition of our program, we're going to be talking about a subject that might be a little sensitive for some people. We're going to be speaking about the prevalency of uterine fibroids and the lack of options that many people feel, many women feel they have to deal with that. Apparently, by the age of 50, some 80% of African American women will experience uterine fibroids, and then it's 1 in 3 adult women who will have them in their lifetime. And to talk about this, to look at the symptoms, to look at the treatment, and to look at a treatment that is an alternative to what many women are told is the only option, and that is hysterectomy, is Dr. John Lipman. He is an interventional radiologist here based in Metro Atlanta.
Yes.
Thanks so much for being at the table to talk about, yes, what is a very sensitive subject. Maybe people don't generally talk about it around the table. But here we are. What's going on? Why is this so prevalent, and particularly in the African American community?
Well, as you say, it's a very common tumor. In fact, it's the most common pelvic tumor in women. 1 of every 3 adult women have the tumor, and up to 80% of African American women have these benign tumors. It runs very strongly in African American families genetically. That's one reason why they disproportionately suffer. The other reason has to do with body fat distribution. Estrogen, which makes these fibroid tumors grow, is stored in body fat. So the more fat you have on you, the more stimulated your fibroids become. And so while you can't pick your parents, you can't do anything about your genetic background, everybody can try to be as close to their ideal body weight. It's good for your fibroid health, and it's also good for your overall cardiovascular health.
And I understand that for many of us that they have no symptoms. I mean, these are benign growths, but then the symptoms that people do have are quite, shall we say, uncomfortable.
Very disabling in a lot of women.
Disabling, that's an interesting term.
Most common reason why women have heavy menstrual periods are these benign tumors. They're hard and firm, they're like rocks. So they'll cause their symptoms based on where they're located in the uterus. Ones that are located along the lining cause the heavy flow that I just mentioned. Ones that are kind of lateral will press on pelvic nerves to cause pain. They may simulate sciatica, go into the back, the buttock, down the legs. Those that are in the front of the uterus will press on the bladder to cause urinary frequency. And so they cause a whole host of symptoms, whether it's heavy periods, pelvic pain, urinary frequency. Those are the most common.
Goodness, and I understand that they also, that would cause someone to have their lifestyle completely altered, and their life focuses around that.
Absolutely. It turns a lot of these women's lives upside down. They feel chained to their menstrual. They have to have extra clothing, extra gear. They have to know where every bathroom is. It's very disabling because month after month they're just losing way more blood than they can produce, so they start to become anemic, they're weak, they're tired, they're worn out. I see a lot of patients that used to exercise regularly. All they can do is get through the day. Exercise goes out the window, they may gain weight. So it's everything they do revolves around this monthly period. They may not work a couple days a month because of the heavy periods. It's
and I'm
terrible.
thinking some of those symptoms, actually, people might think that there's something else, like a urinary tract infection, or, you know, they might go from, I suppose, doctor to doctor or try antibiotics or all kinds of different things before they're diagnosed.
It happens commonly because sometimes women, even the ones that are bleeding heavily, don't recognize that that's too heavy. It's, well, my mom was a heavy bleeder. My sister, who also has fibroids, she's a heavy bleeder. That's what we do. Well, no. You're hemorrhaging. Your mom had a hysterectomy for fibroids because it was so heavy. You're bleeding heavily, and it's too much. If you're changing more than every 3 hours or 2 at a time, or if you're passing clots, a lot of times these women will have blood literally gush and flood out of them, passing these clot-sized chunks of blood. So those are things that are too heavy.
Now, for postmenopausal women, what would be the symptoms? Again, frequent urination? Or
now, yeah, for women that are postmenopausal, typically fibroids are not an issue for them. Once they get to menopause, usually fibroids are not a problem. Now, on occasion, we will treat women that are postmenopausal for bulk-related symptoms, most commonly urinary frequency. So the fibroid is pressing on the bladder causing them to urinate frequently, get up at night commonly. But for the most part, once you get to menopause, usually fibroids are not a problem anymore.
So how young are you seeing patients now? I mean, I'm thinking these fibroids are kind of fed by hormones, and there are a lot of hormones now in some of the foods that we eat.
Yes.
There's a lot more awareness about that. So are you seeing patients younger and younger?
We are seeing patients younger and younger. Usually, the most common age is somewhere between 30 and 55, but we're seeing patients now even in their 20s and even rarely 18,
teens.
19, but typically it's an issue for most women 30 to 55, because while you might know you have a fibroid based on an ultrasound during a pregnancy, usually they're not a problem until farther along in adult life.
So we've talked about some of the symptoms. We talked a little bit about the cause. What are some of the treatment options? And I use that, selectively, the options.
Well, yes, you mentioned about the hormones. We usually start there and try to eliminate, some of the big offenders in the person's diet hormonally. We also encourage exercise and weight loss.
And what are some of those foods that might be impacted by the hormones? I'm thinking meats.
Red meat, chicken, and dairy are the big offenders. Even some of the hair relaxers, it's believed that another reason why African American women disproportionately suffer is that a number of them use hair relaxers, and the chemical main ingredient in this hair relaxer is very similar biochemically to estrogen. And so there are a number of these things that we can try to help the patient lose weight, try to be closer to their ideal body weight. That's certainly going to help. Try to change their diet, more fruits and vegetables. There are certain compounds in colored fruits and vegetables that will block estrogen. They're called flavonoids, and those are helpful. So nutritionally, exercise, that's the best place to start. But then commonly that's not enough, and we move into kind of medicines. Most commonly birth control pills and non-steroidal anti-inflammatories like ibuprofen. The problem with birth control, obviously, what's in birth control pills? Estrogen and progesterone hormones. So it becomes a double-edged sword. On the one hand, it can lighten your flow for a while, but usually it overwhelms the ability because the behind-the-scenes growth of the fibroids by this exogenous hormone, eventually you got to do something else. And in the past, it meant surgery, but we do a procedure called UFE, uterine fibroid embolization, that is completely non-surgical and outpatient.
Now, before we move to that, we have been talking before we went on set about how common it is for women to only be given the option of a hysterectomy, a complete removal of the uterus.
Right. Most women who go to their gynecologist only hear about one option, surgery typically. And which surgery they get largely depends on their desire for fertility. If you're interested possibly in future fertility, you get what's called a myomectomy, surgically cutting out some of the fibroids and then sewing the uterus back together.
Why only some? Hang on a minute.
You usually don't get them all. Very rarely do you get them all, because there's usually a lot more of them that you can get out, because the more you try to get out, the more you might get a hysterectomy. Every woman undergoing myomectomy has to understand that they could get into too much bleeding. These tumors are really vascular. And so if they get into too much bleeding or they physically can't get the defect of the uterus closed surgically, you're going to wake up without your uterus. And every woman has to understand that. So they take what they can.
I suppose,
right, you sign a waiver, and they take what they can, and they close the defect. And but those fibroids that they've left behind surgically, well, they're going to grow. And so within 3 to 5 years, commonly, there's another procedure that's needed versus, again, we'll get to our procedure, UFE, which treats every fibroid in the uterus and does so completely without any surgery whatsoever.
And the hysterectomy, I mean, that's quite a lengthy process of recuperation, the cost, it's taking out a uterus. And again, before we went on camera, you said a uterus is not an appendix.
Exactly. The price of to a woman, the price of hysterectomy, in my opinion, is too steep. Yes, if you have a hysterectomy for fibroids, you won't have a fibroid problem anymore. The problem is the cost to you is way too high, in my opinion, when you have a procedure which will get you the relief of symptoms you're looking for and do it without any surgery whatsoever. and allow you to keep your uterus. Keeping one's uterus is so important for a woman, even if she's family complete. The uterus is not the appendix. It's important for you psychologically. It's the epicenter of your womanness. It's important for you sexually. There is a lot of sexual dysfunction after hysterectomy. People don't like to talk about it because it's embarrassing, but it's real. We know that if you lose your uterus, you have a much higher incidence of bone loss and osteoporosis. And now there's evidence to suggest if you have a hysterectomy before age 50, you increase your cardiovascular risk, hypertension, stroke. It's just not necessary. You don't need to lose your uterus when you have a procedure called UFE, which is outpatient, non-surgical, home the same day with a Band-Aid. Keep all your parts and get the relief of symptoms.
And yet, as we spoke, you said that hysterectomy is the second most common surgical procedure in the United States when, you know,
half the population isn't even eligible.
Right.
So yes, it's the second most common, and the most common reason why we do it is not cancer. If you have uterine cancer, hysterectomy is appropriate, no question about it. But the most common reason why we do hysterectomy in this country is fibroids, and it's not even close.
And why is that? I know maybe a sensitive issue, but why is it so commonly, you know, the only option? And
surgeons are trained to take out parts, and gynecologists are surgeons. That's what they're trained to do. That's what they know. And so that's what they're going to deliver. And that's why it's so important for women to get a second opinion from an interventional radiologist like myself, who is trained in these non-surgical procedures. They're image-guided procedures that replace the need for surgery all over the body. We're talking about fibroids today and replacing hysterectomy with UFE, but we do these kinds of procedures all over the body for a whole host of medical conditions.
So again, you said that this is an outpatient procedure. Is this something that maybe in another year or so people get a follow-up exam and they might have to have it again? Is that?
No, it's usually one and done. We see everyone 3 months after the procedure. We go down their list of symptoms, how's the bleeding, how's the pain, how's the urinary frequency, and they should be able to say without question they are dramatically better or the symptoms are gone entirely. And then we check with an MRI to make sure that all the fibroids are dead. Because if they're all dead, typically my patients are oftentimes over 40, and if you're over 40, you're not going to have enough time to grow any brand new fibroids before you're in menopause. For some women, less than 40, it's really unusual, but we have embolized them a second time, and then they've gone into menopause naturally, you know, whenever. So the vast majority of people, it's a one-time procedure.
So how long does it take a fibroid to grow?
Years.
So they could begin, you know, when a young lady starts her menstrual cycle?
Usually, yeah, young adult or adulthood will start a fibroid. Unfortunately, nobody knows where fibroids come from. We know the chromosome involved, but we haven't got to the gene level. So nobody knows where fibroids come from, but they do grow with hormones. We do know that.
And now, Dr. Lipman, in the second part of our show, we are going to be hearing from one of your patients who's going to be sharing in very intimate detail and must tell our audience about her symptoms, about the treatment, et cetera. Is there anything you'd like to share? And we have about a minute left in this segment of the show about your patients, how many you see, et cetera.
Well, this is what we do. We've seen and done more UFE procedures than anyone in the world. It's just what we're known for. But patients like Ms. Cooks often suffer with the symptoms of heavy periods, which often drain them. They become anemic. Their life revolves around their period. And so that's the most common thing that they'll suffer with. They'll often have pain, urinary frequency. It might wake them up at night. But those are the most common things.
And she will be speaking of that, as I mentioned after our break. Dr. John Lipman, interventional radiologist, he was speaking about UFEs, uterine fibroid embolization, and we'll hear more coming up. So please stay with us, and we hope you in our viewership will stay with us as well. Welcome back to At the Table. I'm Audrey Galex. I have the pleasure of speaking with Dr. John Lipman. He is an interventional radiologist, and we've been talking about UFE, uterine fibroid embolization. Dr. Lipman, if you would please describe what happens, what this process.
As you mentioned, the procedure is called UFE, uterine fibroid embolization. It's completely non-surgical, and the approach is just getting entry into the body. We put a little tiny catheter in at the top of the patient's right leg. It's just a way into the body. The uterine artery branches like a tree, getting smaller and smaller branches. The fibroids are the leaves of the tree. And I can negotiate a little tiny catheter under X-ray inside her uterine artery one at a time and flow direct these little tiny particles to cut the blood supply off to every fibroid in the uterus. Without a blood supply, these fibroids will soften and shrink, and as they do, a woman's symptoms disappear. So she doesn't need any surgery. Patients go home the same day with a Band-Aid. It's totally outpatient. They keep all their parts and get the relief of symptoms they're looking for.
So I initially misunderstood. I thought you were, lopping off or maybe lop on, but removing fibroids. It's not that.
No,
they're allowing them to shrink.
You knock them out from the inside, and they die off.
The blood flow.
As if they were going into menopause, because that's what happens during menopause. The fibroids will soften and shrink naturally. We're just doing that ahead of menopause.
Thank you. And now let's go ahead and hear from one of Dr. Lipman's patients, Christie Cooks.
Okay, around 35, I noticed that my cycles were extremely heavy. Of course, I was under a lot of stress at that time, and my cycles were going 7 to 10 days, sometimes 14 days. I pretty much had to ignore them at that time because I was still raising my kids and still active and still trying to work. But when I turned 40, I noticed that I started gaining a lot of weight. I noticed that it was taking more sanitary napkins on top of that to maintain my cycle. I also noticed that I was very weak. And I knew that I knew something was just not right because my periods would come on, they were irregular. I would have 2 and sometimes 3 cycles a month, so that's constantly bleeding. So I knew then that I had to get some type of help. I didn't know what was going on, but I knew that it was totally, and when I turned 40, my whole life changed. And at the time I was trying to go into the military. And they kept telling me my hemoglobin and blood level counts were just extremely low. Even though they gave me recommendations, they just could never get the levels up to what their status was, which is pretty much the norm for everybody. So I knew then too that I had to follow up with someone who could let me know what was going on with me. I am an ICU nurse first, and I am also a women's nurse, which means I work on postpartum and women's health and stuff like that. So a year before I seen Dr. John Lipman, I was up on a women's floor, and I noticed that my patients, I was still in my 40s, like 40, 44, 45, and they were 35 and under. No kids, some of them had kids and having hysterectomies, even had a patient that was in her 20s that the doctor told her that there was nothing else that he could do for her fibroids, that if she wants total relief, then she need to have a total hysterectomy. And for knowledge is power. Not knowing, that there are other alternatives, and everybody is different. Every procedure is different, but the success rate with having this is much higher. You have to try everything before you just snatch everything out from a woman, because that's a lot. That's your hormones, that's everything. That's what makes you a woman, even after you've went through menopause and you still have a uterus. You still have these things. So seeing young women go through this and seeing the low self-esteem behind it, not to mention the recovery is so long. It's like really having a baby. The immeasurable pain that they were in, after having a hysterectomy, really it hurt me. And this happened like a few months before I seen Dr. John Lipman, and I said, you know, I don't want this to happen to me. You know, when I talked to some of my patients, they were out of fear. They felt like it's no other way. You know, if I don't do this, I'm not going to live, I'm not going to have a good quality of life if I don't do this, you know. I'll think about the kids I can adopt or alternatives. It's just, they were like, just sitting there, they didn't even know about any alternatives. They trusted their doctor, and that, you know, they trusted what the doctor said. They didn't go get a second opinion. Most of the patients that I had, I asked, because I was like, did you even, you know, I was even throwing out, did you try holistic measures? No, I was told hysterectomy is the only way, and I just want it over. You know, the microwave generation. We just want it over. We don't want to, the first opinion is not always the best opinion. My mother told me, you need a second opinion, you need to go see this doctor. You don't worry about the ability to pay or anything, you need to go see this doctor. You know, and I did my research online. I even had a chance to see one of his former patients. I hope it's okay to say that on there. Cynthia Bailey from Real Housewives of Atlanta was on there with her testimonial about how her life changed significantly, how her fibroids had affected her marriage, and how it just had really turned her life inside out. Even though you would have never known this, because this lady is on TV, you would have thought that everything was okay with her. But I must say, from my own experience, it is a mental, it's just like, I felt like, who's gonna want me? I mean, you know, who is going to want to be with me? And I got all these issues, you know. I mean, I didn't even, you know, I doubted my love for myself, because that was very depressing for me and my children. Mama, you're going to be okay. You're going to be okay. You know, it affected my time with them. And my mother, you know, she's watching me, you know, weak all the time, you know, irritable, you know, my hormones all out of whack, and, you know, we not know what's going on with me. You know, I can remember the first time that I told my mother about what was going on with me. I was in my home, and I was walking through getting dressed, and a blood clot that was bigger than my hand fell on the floor, and it wasn't even time for my cycle. At least I thought it wasn't. I ran to the emergency room. She looked up at me and said, well, no, you're not on your cycle. I don't know what this is coming from. My hormones were off, and it was just throwing off everything, and I had started having multiple periods. And, you know, it scared me, because the clots that I was throwing off was the size of my hand. I have a very huge hand, so I had clots this size coming out. That's a lot of blood loss. That is too much blood loss for anyone. And I just dealt with it at that time. You know, I said, well, you know, I was in denial. I'm being honest. I thought, well, this is something that will just pass over. I'll be all right, until the months started turning into a year. And then I couldn't go into the military because my blood level counts were low. And then, you know, I trusted a doctor, and I just felt like, well, her way was the right way without even going to any other alternatives. You know, after I made the decision to see Dr. Lipman, because it was a prayerful decision, you know, and my mother was like the reinforcer. You know, her thing on a spiritual level is that God gives us doctors. He gives us people to help us, and he gives us 5 senses. When you've done all you can, you need to go, you need to pray and go and seek some help for yourself. So that is when I made the call, because again, his commercial came on the radio as I was talking to my mother, and my sister three-way called me in and she said, it just came on the radio. I said, I know. She said, here go the number. I wrote it down. I said, no, I wrote it down. So we were like, you know, they were like my cheerleaders, and my kids was like, Mom, you got to do this. You got to find out what's wrong with you. Coming to Dr. John Lipman's office for the very first time, I was fearful, because I did not know what to expect. You know, I didn't know, even though I had seen the testimonial, I was still like, what to expect. But coming into his office, the support system that I got, the questions that I had were answered, you know, and knowing that I had been actually, and I'm being honest, I had actually been misdiagnosed. I actually had multiple fibroids, at least 20 or more. I had a stomach full of fibroids. So my former doctor was telling me 4, and I had at least 20. I had them. I seen it on the MRI for myself, because I am able to. He showed them to me, and so when I seen this, I said, "Oh my God, I'm walking around basically with a bunch of rocks in my stomach." you know, and it's not getting smaller, they're getting bigger. It's draining me. You know, these are tumors that are just draining the life out of me. You know, coming to him and talking to him, his nurses, his staff was very supportive. Even before my procedure, you know, I was able to call and ask questions, even when I had the procedure. One thing that I will say about having the procedure, it was quick. You know, it was quick. I was not overly sedated. I was awake. I was responding. I was talking. I was answering questions. I felt the support right there, and I felt, and I know in my heart that I was getting the help that I need that would sustain me, you know, until I go through menopause or in the next phase of my life. I just, you know,
fibroid embolization was the answer.
Yes, I knew that it was the answer. It was much safer for me. Instead of walking around here losing God knows how many units of blood I was losing a month, it was less expensive too. You know, people want to know the cost, and no, I don't know the specific numbers, but I know that it costs less to have this procedure done than having a hysterectomy, because you are actually in the hospital after you've had this hysterectomy. You're not going home the same day. You know, you're actually in there accumulating a bill. So I would say I didn't need, post-operatively, I didn't have a lot of pain. You know, I've never been hospitalized ever in my life unless I had my kids. So this was something new to me, but it was not painful. I had energy. I was on my cycle at the time that the procedure was performed, and I was up, walking, and going outside, enjoying the sunshine. Like 3 days after this happened, I was on my normal period. I knew, and I felt energized then, because I'm telling you, I know people are going to be like, no, this can't happen, but it did. I felt like my blood count immediately went up. I'm being honest. I had so much energy, but I think it was a natural energy too, because I knew that finally I've spent 16 years in the nursing field taking care of others, and finally I took control of my own health and took care of myself. So I felt empowered 100%.
We're back in the studio with Dr. John Lipman, Christie Cooks' doctor. Dr. Lipman, seeing what Christie went through and how it transformed her life, what is it that you recommend to other people who are experiencing uterine fibroids?
Well, if you're suffering with fibroids, with symptoms, and the take-home is get a second opinion from an interventional radiologist. Despite what your gynecologist might tell you, even if they say you must have a hysterectomy for your fibroids, get a second opinion, because likely you don't need surgery at all. You could have UFE, which is completely non-surgical.
And it is covered by insurance.
Covered by all insurances. You're home the same day with a Band-Aid, and importantly, you get to keep your uterus.
Thanks so much for being with us at the table.
Thanks for having me.
And thank you for being with us at the table. We'll see you next time.